Hi, I am Dr. Ramakrishna Chowdhary, Consultant Head Department Neurosurgery, Arete Hospitals, Gachibowli, Hyderabad. Today we are talking about intracranial aneurysms. So what are aneurysms? Aneurysms are nothing but the dilatation of the vessel wall, part or the whole blood vessel wall. Why this happens? This is because of the weakening of the vessel wall. Coming to the reasons for this weakening or etiology, cause for aneurysms are hypertension, diabetes, family history, smoking history. All this add up to the development of aneurysms within the brain. So normal populations around 1 per 10 lakh population have aneurysms, but not necessarily every aneurysm ruptures. But depending on the size of aneurysm, the chance of rupture is quite high. So the patient usually present with severe headache, something they say it's a thunderbolt headache, the worst headache in their lifetime. Or if the bleed is quite massive, they can present with a weakness of the limb or speech disturbances, or they can present to the casualty in a deep coma stage. So once the patient comes this way, these symptoms, then we go for the CT scan and the CT angio to look for any abnormal dilatation of the blood vessel, that is an aneurysm. If at all we find aneurysm, then it's mandatory to clip the aneurysm or coil the aneurysm, that is intervention to be done as early as possible to prevent the re-rupture, because the mortality with aneurysm rupture is quite high. So only around 15-20% of patients do die on the way before reaching the hospital. So why this happens? Because when there is a bleed within the brain, there is a sudden increase in the pressure within the brain, causing to the decreased blood flow to the brain, leading to the sudden death. So it's always what we do in aneurysm when they reach the hospital is to prevent the rebleed, to prevent the complications. There are various ways of managing the aneurysms. One is surgical part, where we open the skull, enter underneath the brain, split the brain, go in and look for the abnormal blood vessel and clip the aneurysm. The other method of doing it is something called as endovascular coiling or endovascular stenting, where we take the patient to the cath lab, we reach the intracranial blood vessels from the thigh blood vessel, go through guide wires and deploy the coils within the aneurysm and block the aneurysm. So which one to go, it always depends upon the size of aneurysm, the orientation of aneurysm, how bad the patient is. All these things look into this thing and we discuss with attenders. Then we go ahead either with surgery or clipping of the aneurysm. The mortality rate in the aneurysms has come down drastically in the past few years because of the recent advance in the intraoperative technologies, where we use the microscopes, advanced microscopes and the navigation system to have a good clipping of the aneurysm and to maintain the normal blood flow to the other parts of the brain. And at the same time, good ICU care is required because this patient can go into spasm, that is a thinning of blood vessels post clipping or because of the pathology per se. So good ICU care and a good intraoperative clipping gives a good results. So one need not worry once they say aneurysm is dreaded disease or mortality is quite high, but still the results are quite good in the recent past. Thank you.